Very good morning to you all. Today I'll be talking about sialography. So sialography is defined as a radiographic demonstration of a major salivary gland with the introduction of contrast medium into the ductal system so that it is useful for the diagnosis or for any pathology related to salivary glands or any obstruction within the ductal systems of the salivary gland. So it is mainly an radiographic demonstration for pathology related to salivary gland with the introduction of contrast medium into the ductal system. Coming to the indication, where exactly is sialography indicated? So this sialography is indicated to determine the presence or to know the position of the ductal calculi or the stone within the ductal system. And next indication is it is used to assess the extent of any destruction of the duct or a glandular destruction which is secondary to the obstruction. And third indication is it is used to determine the crude assessment of function of salivary gland, such as in case of dry mouth. Coming to the contraindications where sialography is contraindicated. So one of the major component of this contrast medium is iodine. So individuals who are allergic to iodine, in such individual, this sialography is contraindicated. And second contraindication is in case of acute infection or inflammation, or whenever there is a discharge of pus from the ductal orifices. In such cases, the sialography is contraindicated. And third contraindication is on clinical examination when you get to know that the stone or the calculi is located at or near the orifices of the duct. So whenever you try to, in such cases, whenever you try to inject a contrast medium, you tend to push that stone or the calculi further into the duct, further complicating the procedure. So in these three cases, sialography is contraindicated. Coming to the procedure or the phases in which the sialography is categorized. So the sialography is done mainly under three phases. That is, first phase is preoperative phase, second phase is filling phase, and third phase is emptying phase. Coming to preoperative phase. So what exactly we do in preoperative phase? So this phase includes taking up a scout radiograph. That is radiograph that is it could be OPG or a lateral oblique view or occlusal view or a PA view. So any of these radiographs can be taken before the introduction of a contrast medium because for the following reason. So that by this through this radiograph you tend to know the position or the presence of any obstruction within the duct, or it is also helpful for the assessment of position of any shadow of the normal anatomical landmarks which will be casted onto your glands, such as your midline structure such as hyoid bone, the shadow of this hyoid bone which will be casted onto your parotid gland, so that you cannot appreciate the location or the position of the stone within the duct in such cases. And also this scout radiograph, taking up of a scout radiograph, it is useful to assess the exposure factor. So when you, after introduction of the contrast medium, you need to adjust the exposure time with the within this X-ray machine. So to assess that exposure factors, you're supposed to take scout radiograph before the introduction of contrast medium within the duct. So that is your preoperative phase. Coming to the filling phase. So what exactly we do in filling phase? So in this phase, what exactly we do is we will be first thing we will be doing is you will be locating the orifices of the duct. So once you locate the orifices of the duct, whether it could be a parotid duct orifices or submandibular duct orifices, once you locate it, you have to probe it and then you have to dilate it. So how was it done? So this picture which shows the assessing or the locating the orifices of the duct, and once it is located, it is dilated with the help of a lacrimal probe, or lacrimal probe is inserted once your orifice of the duct is located. So once this lacrimal probe is inserted, it is the orifice of the duct is dilated. After that dilation, you will be taking out the lacrimal probe, then a cannula is inserted within the ductal orifices. So once this cannula is inserted, next phase is you will be introducing the contrast medium through this cannula. So this the introduction of the contrast medium can be done in three technique, that is simple injection technique, hydrostatic technique, and continuous infusion pressure monitor technique. So these are the three techniques through which you can inject the contrast medium into the ductal system. Coming to the simple injection technique. So what you will be doing is, in this technique, what they do is, they'll be introducing the contrast medium gently with a hand pressure until the patient experiences discomfort. The contrast medium is injected for approximately about, it needs about 1 ml for parotid gland and 0.8 ml for submandibular gland. So until the patient feel discomfort, in simple injection technique, you will be injecting the contrast medium. Coming to the hydrostatic technique, here what they do is, in this technique they'll be using the overhead reservoir. In that reservoir only they'll be it will be loaded with the contrast medium. Through that reservoir, overhead reservoir, this contrast medium is injected under a force of gravity. Continuous flow of the contrast medium will be there under the force of gravity until the patient experience discomfort. Once the patient experience discomfort, the injection of the contrast medium is stopped in hydrostatic technique. Next, third technique is continuous infusion pressure monitor technique. So in this technique, what they do is, a constant flow rate and a ductal pressure is maintained and it is monitored and throughout the procedure. And so this constant flow and a constant pressure is monitored with the help of a monitoring technique or a device, and then contrast medium is injected. So those are the three techniques through which contrast medium is injected in filling phase. So after filling is done, after filling injection of the contrast medium is done, next thing you will be doing is, again you will be taking a radiograph. Either it can be a PA view or a lateral oblique view or occlusal view. So based on the involvement of the gland, you are supposed to take a radiograph, such as OPG and lateral oblique view is helpful for any pathology or a ductal obliteration or obstruction of your parotid gland. Whereas if the submandibular duct is obstructed, then occlusal view is helpful. And even your PA view is also helpful for both the ductal obstruction. Once the injection of the contrast medium is done in filling phase, again you need to take this radiograph, and then after that emptying comes your emptying phase. So in this phase the cannula is removed and the patient is asked to rinse his oral cavity. And once it is done, you will be squeezing a lemon with, or else you can also advise Sialography for the patient so that to increase the salivary excretion. So once the salivary excretion is increased, your contrast medium tend to get excreted fast. So with the help of lemon or a Sialography, salivary excretion is increased, and then your contrast medium will be coming out of your duct. So once it is done, after 5 to 10 minutes, again you are supposed to take a radiograph in emptying phase, so that to know whether any remnants of or any remnant of a contrast medium is left out, or any amount of contrast medium is left out, or the duct is completely clear. To assess that, radiograph is taken. So once this is done, this phase is, once the excretion of the contrast medium is done, this phase is all over. So that completes your Sialography, Sialographic technique. Now coming to the contrast medium which we use in Sialography. So there are mainly 4 types of contrast medium which we use in Sialography, under which aqueous solution is most commonly what you call it, preferred contrast medium. So what are those four contrast medium is? First is the ionic aqueous solution, non-ionic aqueous solution, oil-based contrast medium, and water-based contrast medium. So under all of this, water-based contrast medium is most commonly preferred because it has certain advantages and over oil-based contrast medium. So coming to the what are the disadvantages and disadvantages of oil-based and water-based contrast medium. So the advantages with the oil-based contrast medium is, as this contrast medium is very dense, so it gives a very good contrast. You can be able to appreciate even the finer details because it is very dense and it is very radio opaque when you take a radiograph. Next advantage is it is highly viscous. So as it is, because of its high viscosity, the excretion from the gland is very slow. So even if you delay the procedure also, the excretion of this contrast medium will be very slow. It will be retained within the duct. So you can repeat the procedure even if in second time you want to take the radiograph also, that this contrast medium tend to be retained within the ductal system. So these are the two advantages of oil-based contrast medium. Coming to the disadvantages of oil-based contrast medium is, as this is very dense, it needs a high pressure or high pressure to inject the contrast medium within the duct, and it is highly viscous, also, so that it needs a lot of pressure to inject. Sorry. So as it is highly dense, this contrast medium tend to retain within the tissue. So it may cause an allergic response in patients, as it tend to retain within the tissue even after the excretion, even after the emptying phase also. That is one advantage. Disadvantage. Second disadvantage is it is highly viscous. So as it is highly viscous, a high pressure is needed to introduce this contrast medium within the duct. So these are the two advantages and disadvantages of oil-based contrast medium. Coming to the advantage and disadvantage of the aqueous contrast medium. So the coming to the advantage, that is this aqueous contrast medium or a water-based contrast medium, it has a low viscosity. So because of its low viscosity, it can be injected easily within the duct, and it is because of its low viscosity, it can be excreted very rapidly from the gland, and it is also easily absorbed within the gland also. So these are the advantages. Disadvantages, because it is less viscous and less dense, it is less appreciable, or it is less radio opaque. When you tend to take a radiography, you will not be able to appreciate properly the final details or the final changes or fine changes which is seen in the radiograph. It cannot be appreciated with this. That is one disadvantage. And the other disadvantage is it is rapidly excreted from the gland because it is water-based and it is low viscous. These are the advantage and disadvantage of contrast medium, oil-based and water-based contrast medium. Now coming to the normal what you call it as normal radiographic appearance of your submandibular and parotid gland on after taking your radiograph. That is, normal sialographic appearance of a parotid gland usually appears like tree in winter appearance. And this picture shows a normal sialographic appearance of a submandibular gland, which usually gives a bush in winter appearance. So with this, I conclude. Thank you.